I've heard a lot about immunotherapy and chemotherapy, and I wanted to do it for all the young girls and all the young people that I see that have to suffer with cancer, and they get prognosis and they're scared to death. It was 2019, and I learned I had triple negative breast cancer, which is not a good thing.
Molly was diagnosed with a very different type of breast cancer. About 15% of breast cancers are what are termed triple negative. When Molly was diagnosed, there were trials that were ongoing looking at how is the best way to treat this cancer. And so she combined her cancer care between the University of Kansas Cancer Center and Olathe Health Cancer Center.
I got in the trial, and it was a really good thing that happened to me.
Once she came here, we were able to find a clinical trial for her that was actually developed and designed here at KU, through which she could get access to immunotherapy in combination with chemotherapy. Back then, immunotherapy was not approved for her stage and type of breast cancer. So she was able to participate in that trial. I would say she was brave enough to participate in that trial. She did very well with the treatment and had an excellent response. 2-3 years after her diagnosis, immunotherapy really did get approved for her type of breast cancer. So now it is standard of care, and we're able to offer it to all patients. But back then, the trial was the avenue for her to access latest and newest treatment.
To me, it was a blessing that I got to be in a trial that is now approved by the FDA, and it was a piece of cake. I hate to say it, but I don't even think I took Advil. I don't know. After I finished my chemo, I think in March, I had to have surgery in April, and I had it in my left breast and my lymph nodes.
Women will typically see 3 physicians that will coordinate their care. And that is because breast cancer really needs to be addressed in a multi-modality treatment fashion to have the best outcome, the best chance of cure.
I got to have my radiation out here with Dr. Rhodes-Stark, which was wonderful because I live out here. So it was the best of all worlds.
We discussed her care. She knew that she would have the same treatment here from a radiation standpoint. And so then I, along with my team, we directed the plan for her radiation treatment. She came here once a day, Monday through Friday, for a few weeks. She did beautifully, completed all of her treatment on time, didn't skip a beat.
I don't want people to think that just because you get a nasty prognosis that that's the end of your life.
She had a fantastic result. She had what was called a pathologic complete response, so couldn't even find any cancer remaining in the breast or lymph nodes. So that shows the power of the treatment advances that we've had.
I didn't have one bad experience through the whole thing. So if anybody's even thinking about it, getting into a trial at KU, I would not hesitate for 1 minute. And maybe that's what God wanted me to do, get it and go through it and have a positive experience so I can tell other people how wonderful they are.